Greetings, marketing students. Dr. R here, and today we're going to be talking about predicting consumers' behavioral intentions. First, a quick review. Recall when we talked about attitudes back in Module 2? I described them as predispositions to act. So if we have an attitude toward a specific behavior, we are inclined or predisposed to act on those attitudes. However, the correlation between the attitudes that we state and our actual behavior is not perfect. We do not act on every positive attitude that we have towards behaviors. But attitudes significantly predict behavior under certain conditions. And this is where the theory of planned behavior places attitudes within the broader context of the various factors that influence behavior. Here you see a basic depiction of the basic model for the theory of planned behavior. Now, this theory was developed by renowned social psychologist and scholar Dr. Isaac Eisen, and it builds off of the theory of reasoned action, which is just these three components right here, and he elaborated on it by adding the perceived behavioral control to more strongly predict intentions and behavior. The factors that the theory of planned behavior uses to predict people's intentions are behavioral attitude, subjective norms, and perceived behavioral control. The key here is the strength and specificity of a person's attitude toward a behavior. For instance, if we're talking about charities, a general attitude toward charities and charitable giving is not going to predict a person's specific charitable donation behavior very well. However, an attitude toward donating a specific amount of money toward a specific charity at a specific point in time will more strongly predict the person's intentions and behavior to enact that particular charitable giving behavior. Stronger attitudes are connected to our self-concept and our self-interest, and thus are more closely tied to our behaviors. They also tend to be behaviors we share with families and friends, and it is part of how we feel connected with them. So there's a social component as well that dictates why our attitudes influence our intentions and our behavior. We are also influenced by how others behave and how we believe others expect or want us to behave. These are called subjective norms. So if a tragedy such as an earthquake strikes in a nearby country causing devastation, and your friends and family are all donating money to the cause and talking about it, you might feel some social pressure to conform to their expectations that this is the right thing to do right now. Another important factor is my perception of how much control I have over that behavior. If you do not have any disposable funds at the moment, you may not feel control over performing the action of donating money because you have no way of obtaining extra funds for this purpose. So as a general rule, the more favorable the attitude and subjective norm with respect to engaging in the behavior, and the greater the perceived control, the more likely it is that a person will form an intention to perform the behavior in question. And intentions are expected to lead to performing a behavior as long as the person has actual control over the behavior. Now, the theory of planned behavior does not assume rationality on the part of the decision maker. Any of these contributing factors, such as attitudes, subjective norms, or perceived control, could be misinformed based on unconscious biases, could be wishful thinking, paranoia, or some other irrational process. The theory does assume that people's intentions and behaviors follow reasonably and consistently from their beliefs, no matter how these beliefs are formed. Also, people do not necessarily undergo careful examination of beliefs each time they perform a behavior. Rather, with repetition, behaviors become routine and are performed with little conscious consideration. So that's something to consider in terms of what type of consumer behavior you're trying to predict, because there are many consumer behaviors that are just routine, habitual purchases, and it would be difficult to alter those by trying to affect either their attitude, their subjective norms, or their perceived behavioral control without snapping them out of that habitual or routine process. Just one more thing before we move on and continue with our discussion of the theory of planned behavior, and that is I wanted to elucidate the consumer decision processes that underlie purchase behavior to give a context for what are the types of behaviors that we're trying to predict. Depicted here, you see the 5 basic stages in problem solving or in consumer decision making. It begins with need recognition or problem recognition, information search, evaluation of alternatives, purchase, and post-purchase. And of course, any of the pre-purchase stages may be considerably less extensive if purchase involvement is low, the decision is routine, or if the decision is impulsive. So which consumer decision-making stage are we applying the theory of planned behavior toward? While we could apply it to information search or the likelihood of evaluating alternatives, really what we're interested in is purchase. So that is the focus of our prediction. So intentions to purchase, and then for post-purchase, it could be their intentions to use the product, to spread positive word of mouth about the product, to repurchase the product. So purchase and repurchase are the key areas that we would be applying the theory of planned behavior toward.